Nursing school may not be medical school, but there's no question it's challenging. In fact, for students managing a job, personal life, and their nursing studies all at the same time, the challenge may seem insurmountable. How are you supposed to read all those chapters, attend labs, take notes, prepare for exams, and remember everything you're learning while still maintaining some semblance of a normal life? It's hard, but it is also possible. The key is to study smarter, not harder. These are some tips that you can take into account if you are a nursing student or thinking to lead to this career. 1. Include study breaks in your studying. Your brain starts to become overloaded with information after about an hour or so of studying. Continuing to study after your brain is full is ineffective. Studying for 3 or more hours at a time without taking a break is not the best way to retain information. The most effective studying occurs during short 45 to 60 minutes study sessions with breaks in between. When you take a break, actually get off where you're studying and participate in some other activity for at least 10 minutes. This will allow your brain to decompress and prepare to learn and absorb more information. 2. Discover your learning style. A key to effective learning is discovering your learning style. Everyone has different learning preferences that benefit them. Some students have a dominant learning style. This means they learn best when they acquire information in a specific way. For example, some students learn best through seeing. Others learn best through listening. And some students learn best through hands-on and tactile interaction. If you learn best by writing out your class notes, then you may be a kinesthetic learner. Discovering your learning style will help you structure your study of nursing in a way to provide optimal efficiency and effectiveness. 3. Focus on critical thinking, not memorization. You are going to be required to learn and memorize a lot of information as a nursing student. But don't get distracted from the most important skill you need, and should be developing critical thinking. Nursing programs and exams are designed to force students to develop and use critical thinking skills. Facts and data are useful, but they won't enable you to evaluate a patient's unique condition and situation. 4. Think about the application of what you're learning. Becoming a nurse is much more than just acquiring medical knowledge and facts. Your patients aren't going to care what you know, they are going to care how you can help make them feel better. As you study different health conditions and explore human physiology, always ask yourself how you're going to apply what you're learning to help your patients become healthier. Think about how you will discuss each condition you study with a prospective patient. Do this and you'll not only become a better nursing student, but a better nurse. 5. Time management. Effective time management is essential to success in nursing school. The most important aspect of effective time management is setting a schedule and sticking to it. At the beginning of each semester, review your nursing syllabus for important dates, including assignment deadlines, clinical hours, and exams. Once you identified all important days, use a planning device, for example, a calendar or phone, to keep track of these dates. Now, create a monthly and weekly schedule that includes the tasks, milestones, and goals for preparing for each of these dates. At the beginning of each week, plan your week identifying what you need to accomplish daily in order to meet your weekly goals. 6. Diffuse oils to help increase concentration. If you need a little pick-me-up before studying, Try some essential oils, like lavender, rosemary, and peppermint oils, have all been studied and have been shown to increase concentration and retention. Try diffusing the oils or dabbing a little on your grades before sitting down to a study session. 7. Study daily. A fatal mistake many nursing students make is to leave their studies to the weekend or procrastinate until exam time. There is no place for procrastination in nursing school. You can cram a week's worth of studies into just a few hours, or wait until the end of the semester and expect to learn everything you need to know to pass your nursing exam. A key to excelling in nursing school is to study every day and stay caught up. Studying just a little every day is key to success in nursing school. 8. Study the right material. There aren't enough hours in the day to cover in depth all the material you'll be assigned to read and study as a nursing student. Part of your job is to determine what material is the most important and where you're going to focus your study time. I recommend paying close attention to the topics your instructor covers in class. The topics your instructor focuses on and the key points emphasized during lecture is where you should focus the bulk of your study. 9. Create a study ritual. Pay attention to how you feel when you sit down to study. Are you dreading it before you even begin? Running internally? Exhausted just thinking about it? It may be time to reevaluate your study environment. There is no reason to make study time something you absolutely hate. Instead, try to set up little rituals for yourself before and while you study to make it more enjoyable. Try setting up a special corner, lighting a candle, or even staging your favorite snacks nearby for a little treat. And on the flip side, if you are a creature of habit while studying, you could also try mixing up your environment. Get out of your house or apartment and visit a new coffee shop or deli to get some new sights and sounds while you study. 10. Skim first, read second. Nursing school requires a lot of learning, and much of what you learn is going to come from reading. To facilitate learning through reading, skim each chapter of your textbook before reading the entire chapter. As you skim the chapter, try to get a sense of the main themes and topics being covered. Read the chapter headings and subheadings. Review the chapter summary and any end of chapter questions. Try to determine what information is most important and then go back and read the entire chapter with purpose. And yeah, I hope these tips are helpful. Thanks for listening. Bye!